Hi, I'm Dr. Ilya Sobel,
And I'm Dr. James Young with Urology of Virginia.
and we want to talk to you about Urology of Virginia's Stone Pathway to try to help you get through this difficult time a little bit easier.
So are there any medications that you could take in order to help minimize the stent discomfort?
Thankfully, there are. It's going to seem like a lot of medicines. I would call it almost like a cocktail of medications that we would use, but you have to think about it in terms of what the symptoms are. So for flank pain, very often, if you take a dose of Flomax or tamsulosin, that may be helpful. People may be familiar with that medicine to help them pass stones as well. For discomfort in the bladder, with that frequency, urgency, and that pressure to need to go all the time, there's a class of medicines called anticholinergics, and as long as it's safe for you to take it, and not always for everybody, so we'll check that for you. There's medicines such as oxybutynin, which is not a narcotic, Sanctura, trospium. These medicines may cause a little bit of dry mouth or constipation as a side effect, but they hopefully will decrease that side effect of feeling the urgency and need to go so frequently. And lastly, anti-inflammatory medicines, if it's safe for you, as well as something like ibuprofen or Aleve, as well as something called Pyridium, which is something that turns your urine a bright orange color. That helps with burning. So what's the right surgery for any situation?
It might not be a surgery at all. Watchful waiting or expecting the stone to pass with the aid of Flomax certainly is a good option for some folks with a smaller stone that might be further down the pipeline, so to speak.
What's left with is three options. One which is called shockwave lithotripsy, one that folks are typically pretty familiar with. So that's shock waves that are delivered from the outside of the body that are going to hit the stone, break it up, but then you're going to be responsible for passing the fragments. That is a treatment that is effective in very particular situations. So if you have a smaller stone, it's a single stone, it's in the correct location, and we have something called a skin to stone distance, and the density of the stone is appropriate, that might be a great option for you. Particularly in the sense that it avoids a stent most of the time, and that's what a lot of folks are trying to do, is have a procedure that avoids a stent. The other two that are left are one that we discussed earlier called ureteroscopy with laser-lithotripsy, and that's basically a tiny camera that goes in through the bladder, through the urethra, into the bladder, up the ureter tube, all the way to the stone. We use a small laser to break up the stone and then remove the fragments. Typically, we will exchange the stent at the end of that. And that's probably the one that most patients fall under. It's kind of treats with a lot of medium-sized stones. The last one is something called percutaneous nephrolithotomy, and that's a procedure where really it's designed for very large stones, and we're actually going through the back about an incision about an inch, and then using larger devices to get to the stone. But we're talking about stones that are probably filling half the kidney or a quarter of the kidney, so just a completely different order of magnitude in terms of trying to get to this. So we're using much larger instruments in this situation. So one of the most common surgeries that's performed for kidney stones is ureteroscopy and laser-lithotripsy. Dr. Young, can you tell me a little bit about what can a patient expect? What are the risks and benefits? How does the procedure work?
Again, it is one of the more common procedures that we do for management of kidney stones. There's two different scenarios: if you have a stent in versus if you don't have a stent in. If a stent is in, like we talked about previously, the ureter is dilated, it's a little bit easier, and the number of complications are less frequent because of that. If it's unstented, in general, there is a 5% chance we might not be able to treat that stone that day you're there.
Is that because the ureter, the tube is too tight for the camera?
Sometimes it is, and sometimes the stone is so stuck in there that there is some tissue that is growing around it, some edema or tissue swelling, which also will be decreased if there is a stent there.
So if it's not safe or if it's not possible to remove a stone that day, what do you do?
We just put a stent in and come back usually a week to 2 weeks later. Ureteroscopy is it's a very simple procedure. You're asleep for this. We pass the telescope into the water channel, into the bladder, and then up the ureter to where we see the stone. We break the stone up with a laser and pull all the fragments out. Hopefully there'll be no debris left in there. Reasons why we might want to choose a ureteroscopy would be if it's pre-stented or if there are additional stones within the kidney.
And what about stones in the kidney? I mean, here we can maybe break them up and it seems like they want to come down even if they're smaller fragments. But what about a medium stone volume in the kidney, let's say totaling about 1.5 centimeters or so, and you're working for a while in that kidney? What are the chances? Is it possible to get all the stone out? Is it possible to not be able to get it all out?
It's our goal to get rid of all the stones at that time.
But I would say the majority of the time we're able to get the stone out. But stone surgery is a little bit like dropping a bunch of dishes in your kitchen. You would take them, sweep them up, take a vacuum cleaner, vacuum all the floor up, and very often, a week later, you may find a small fragment in the corner. And so our attempt and our goal is to remove all the stone. But it's very common to have small fragments left behind after this procedure.
Oftentimes after we do a ureteroscopy, we will leave a stent afterwards because there's blood, some stone debris, and the tissue is a lot like the gums. If you don't floss often, the tissue swells, creating some points of obstruction or potential obstruction, which could cause you some pain after the surgery.
It sounds like even though we've removed the stone, because of the swelling that happens maybe at the location where the stone was or from the camera going up and down, you need a stent afterwards to help the kidney heal. Is that correct?
Usually 5 to 7 days afterwards.
So, and what are the options there? If we only need it for such a short time, how do we remove it and how does that work?
Depending on how much swelling we perceive, how much stone debris is left, we might leave a string attached to the stent and tape that outside the body to the penis or lower abdomen for females.
And if we don't leave a string, then what's the
Then
retrieval
we will
method?
have to pass a telescope into your bladder and then remove it with special grasping forceps in the office.
It sounds like generally it's a pretty short period of time, maybe 5 to 14 days, depending on the situation.
Yes.
Can you tell me a little bit about the risks of ureteroscopy?
They're relatively few and far between. However, if they happen to you, they can be very serious. 5% risk of not being able to get up to the stone and treat the stone completely. And then very rarely, about 1% of the time, we can damage the ureter with the laser telescopes, dilators that we use to get up to the stone. If there's any signs of infection there might be a biofilm on the stone or on the stent. There's about 1 to 5% risk of sepsis associated with surgery. And then there's the stent discomfort, which causes the frequency, urgency, and discomfort. As you urinate, the pressure in your bladder is transmitted back up to the kidney, creating a certain discomfort.
Sounds like pretty low numbers, though, given the benefits.
It's one of the more common things we do and relatively few problems associated with it.